Hi, my name is Pearl McElfish. I am an assistant professor in the College of Medicine in the Department of Internal Medicine. And I've been doing research with the Marshallese community for the past 4 years.
My name is Julayson Rubun-Tutaro. I work at the University of Arkansas for Medical Science in Northwest Arkansas at the Community Health and Research Department. So as a research coordinator at UAMS, one of my major responsibilities was to educate participants in the Diabetes Self-Management Education Program. In the Marshallese community, we are very family-oriented. Most people eat from one pot, so it is very hard for a person who is diagnosed with diabetes to try to be healthier when everybody else in the household will provide something else. We try to, as I said, we try to eat from one pot, so it's very rude to have to try to make something different when everybody else is eating one thing.
Diabetes in the Marshallese community is a real crisis, and there are about 50% of the Marshallese adults who have either prediabetes or diabetes. And so we've been working with the Marshallese community to find solutions and found that working with the entire family is the best solution.
In order for us to bring the study, the Diabetes Self-Management Education Program, into the community, we had to first conduct it or pilot it in the community. So we did pilot the study with 6 families, and each primary participant had to invite up to 10 family members to pilot the study in the community. We also had to gather board members and community leaders to help us in creating the curriculum and make it more culturally appropriate.
The family model is really a diabetes self-management program that meets all of the American Diabetes Association standards and the American Association of Diabetes Educators standards. So it's 10 hours of education that teaches people about what they should eat and how they should exercise and all of those elements. The important component is that it also includes family members. And by including family members, we focus on family goal setting and family motivational interviewing so that the changes that we're requesting take place with the entire family. And the idea is that the patients will be more supported and are more likely to make those changes if the entire family makes the changes.
The program consists of 2 curriculum, which was the family model and the standard model. The family model was where we have the primary participant invite family members to join in the sessions, and the standard model was where random people were selected to attend a class with an American English-speaking educator and a Marshallese interpreter.
Through a randomized control comparative effectiveness trial funded by PCORI, found that the family model was more effective than the standard model in treating diabetes for the Marshallese community. We had an average or mean drop in the HbA1c, which is the primary marker for glucose control or blood sugar control. We had an average drop of 1.3 units. That is both clinically significant as well as statistically significant over the 250 participants that participated in this study. However, we delivered it in homes, and it was quite expensive, and there were many logistical barriers. And so the next step in making this sustainable is to really test the family model in a clinical setting. And if we can show that it's effective in a clinical setting, then it's more likely to be reimbursed and integrated into standard clinical care, which would make it sustainable. So we're asking to do an implementation study that would allow us to document the feasibility as well as the facilitators and barriers of implementing the family model in a clinical setting. This would allow us to successfully apply for an R01 and ultimately translate the knowledge that we've learned into clinical care. Our long-term goal is to improve the diabetes-related outcomes and quality of life among Pacific Islanders. The objective of this pilot grant is to implement a Type 1 hybrid implementation study. The pilot grant will test the family model of diabetes self-management education in 20 families in the UAMS clinic, which we often refer to as the North Street Clinic. We will test the feasibility of implementation in a clinical setting, along with the barriers and facilitators to implementing the study. Our specific aims are to test the feasibility of recruitment and retention when delivering the family model of diabetes self-management education in a clinical setting. The second aim is to test the effectiveness of the diabetes self-management education intervention to improve diabetes-related outcomes among Marshallese patients. And aim 3, document the barriers and facilitators of implementation in a clinical setting.
So North Street Clinic is located at the Fayetteville campus for UAMS, and I am in one of the exam rooms. And what we do here at North Street Clinic is diagnose and treat people or patients with diabetes, as well as give them education on how to manage diabetes. We're from a country where a lot of tests were done, so research were done on us, and a lot of those research do not come back to give us information on what the results were. So it hurts us, knowing that, oh, they're going to do these studies again on us, but for what? What were the results? It's very important that we let the people know, especially if you say it's a research, the results. People want to know where they're at with their health. So we have town halls where we will let people know of what types of project we do or what type of projects are completed. And during those times, most of the information that the community need will be disseminated to the people who attend town halls.
This pilot grant is really important to the Marshallese as well as to translational science. We will use this pilot data to resubmit our R01 to the National Institutes of Health. With the data that we get from this pilot grant, we're confident that we can have a successful resubmission of our grant, and that project will be a fully powered randomized controlled trial comparing the family model of diabetes self-management education to a standard model of diabetes self-management education in a clinical setting. So this pilot will allow us to develop new relationships with implementation scientists. It will allow us to continue our work with the Marshallese community, and it will help us be successful in getting a broader NIH grant, which will lead to successful translation of the family model into the clinical setting.